12 early warning signs of pancreatic cancer, mostly ignored. According to the American Cancer Society, an estimated 62,210 Americans will be diagnosed with pancreatic cancer in 2022. It is the third most common cause of cancer-related deaths in the U.S. The problem with pancreatic cancer is it comes without any early warning indications. The pancreas is hidden behind numerous organs in the belly, including the stomach, small intestine, liver, spleen, gallbladder, and bile ducts. Therefore, if a cancerous tumor starts to form in the pancreas, you might not notice it until it is too big. However, there are some vague but worrying symptoms. Let's go through them so you can seek timely medical attention. Number 1. Nausea and vomiting. The symptoms of pancreatic cancer depend upon the location where cancer has been developed. According to a study in the Journal of Pain and Symptom Management, if cancer expands and presses the far end of your stomach, the stomach can be partly blocked. This makes it hard for the food to pass through. This might result in nausea and vomiting. The nausea and vomiting get worse after a meal. Number 2. Pain in the stomach and back of the body. Pain in the upper part of the abdomen and middle or upper region of the back is one of the most common symptoms of pancreatic cancer. These are the symptoms that come and go. A study published in the British Medical Journal shows that these symptoms usually appear when the cancer is developed in the tail or body of the pancreas, which puts pressure on the spine. In some patients, this pain originates from the middle abdomen to the back. Lying down often makes this pain worse, whereas it can be relieved by leaning forward. Number 3. Jaundice. Often the tumor is formed in the head of the pancreas, which is near the common bile duct. This causes blockage of the bile duct, as a result of which the bile cannot reach the intestine, and bilirubin builds up in the body. This ultimately results in jaundice. According to the World Journal of Gastroenterology, jaundice caused by pancreatic cancer is usually painless and associated with yellowing of eyes, nails, skin, darker urine, pruritus, and greasy, pale stool. Number 4. Weight loss. Unexplained, significant, and unintentional weight loss is quite alarming and should be addressed as soon as possible because it can be a symptom of an underlying serious medical condition. A study published in the journal The Oncologist shows that unintended weight loss is one of the most common symptoms of pancreatic cancer. Number 5. Fatigue. Fatigue or extreme tiredness is one of the common symptoms of many diseases, including pancreatic cancer. An individual can experience fatigue or tiredness due to various reasons. However, if this severe tiredness has no specific reason, it should not be neglected and addressed immediately. According to a study published in the journal Acta Biomedica, unexplained fatigue is often a sign indicating that something wrong is going on within your body. Number 6. Loss of appetite. Many medical conditions and diseases, including pancreatic cancer, are associated with symptoms such as loss of appetite or poor appetite. As pancreatic cancer grows and spreads throughout the body, the individual loses appetite. Pressure from a pancreatic cyst or tumor on the stomach or small intestine results in digestive problems such as indigestion, nausea, weight loss, a low appetite, and diarrhea. This eventually leads to weakness, fatigue, and significant weight loss. We've made it halfway through our list, and we sincerely hope you've enjoyed it so far. Please don't forget to subscribe to my channel, hit the like button, and ring the notification bell if you want to see more content like this. Let's move forward with the video. Number 7. Enlargement of gallbladder and liver. Sometimes cancer in the pancreas expands and blocks the bile duct. This causes bile to build up in the pancreas, and the size of the gallbladder increases. According to the study published in the World Journal of Gastroenterology, your doctor can easily feel this enlargement of the gallbladder during the physical examination as a big lump located under the right region of the rib cage. Moreover, imaging tests can also detect an enlarged bladder. Not only the bladder, but pancreatic cancer can sometimes cause liver enlargement too. Number 8. Gastrointestinal issues. Research published in the World Journal of Gastroenterology indicates that when the tumor grows and begins to press the stomach or other parts of the digestive tract, an individual is likely to experience gastrointestinal issues. Some of these symptoms include indigestion, constipation, loss of appetite, nausea, vomiting, swelling, or bloating in the abdomen. No doubt these kinds of symptoms are associated with numerous other diseases and infections as well. However, they are pretty common symptoms in the case of pancreatic cancer too. Therefore, the best approach is to seek medical attention when you experience these symptoms. Go for diagnostic tests to reveal the root cause. Negligence of these symptoms may make the situation worse. Number 9. Diabetes. Diagnosis of early stages of pancreatic cancer is possible through medical image scanning that has been performed for some other reason or any other condition like diabetes. The sudden onset of diabetes might be triggered by cancer formation in the pancreas. This kind of diabetes is usually not related to weight gain. A study published in the World Journal of Gastroenterology suggests that pancreatic cancer may also be associated with diabetes with no obvious cause. The cells that make insulin in the body can be destroyed by the spread of pancreatic cancer. As a result, the sugar level in the body rises. In most cases, the cause of diabetes is not cancer. Still, the patient should be evaluated to make sure there is no serious underlying reason behind diabetes, such as pancreatic cancer. Number 10. Blood clotting. Research published in the journal Hepatobiliary Surgery and Nutrition indicates that a blood clot in the large vein, usually in the leg, is the first hint that a person is suffering from pancreatic cancer. Medically, this condition is termed DVT, or deep vein thrombosis. Symptoms of DVT include swelling, warmth, and pain in the affected area. In worse cases, the fragment of the clot may break off and travel to the lungs, making it difficult for the patient to breathe. This condition is also associated with severe chest pain. The presence of blood clots in the lungs is referred to as pulmonary embolism, or PE. Remember, clotting of blood may be caused by other conditions, so having blood clots does not necessarily mean that you have cancer. Number 11. A rise in body temperature. According to a study published in the Journal of Medicine, when cancer cells develop in the body, a rise in body temperature is usually experienced. Fever and chills can be caused by pancreatic cancer in one of two ways. First, the common bile duct is typically blocked by pancreatic tumors, and this might result in an infection. Secondly, the body's reaction to an inflamed pancreas causes fever and chills. Number 12. Itchy skin. Research published in the Journal of Clinical Medicine shows that itchy skin, which is medically termed pruritus, is one of the common symptoms of pancreatic cancer. However, like most of the symptoms associated with this cancer, itchy skin does not solely indicate that the person has pancreatic cancer. Several conditions and diseases have itchy skin as one of their symptoms. As discussed above, most symptoms of pancreatic cancer are very much similar to the signs and symptoms associated with many other medical conditions and issues. This can result in a delay in the diagnosis of pancreatic cancer. However, when pancreatic cancer is diagnosed, many patients tend to look back and start connecting various symptoms that are unrelated at the time. It is important to listen to your body and consult with a medical practitioner regarding any new symptoms that you experience. In most cases, cancer is not the main culprit. Still, you need to make sure and confirm the case through various diagnostic tests and prevent the situation from getting bad to worse. Do you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!